Good morning, everyone. Thank you for joining us today at the Carnegie Endowment, but in this Brookings Institution and Wounded Warrior Project event. I'm Mike O'Hanlon with Brookings, and we are just honored and thrilled to be collaborating with our good friends at the Wounded Warrior Project this morning on their very important work. They do so many things for our wounded warriors around the country. The focus of today's conversation is going to be built largely, as you know, around a survey, which they've been doing now for a number of years, and have a data stream on the quality of care and many other aspects of the quality of life of our nation's wounded, ill, others who have served and had some kind of serious consequence as a result, or otherwise have challenges that they're facing in their lives today. The Wounded Warrior Project has done remarkable work and continues to, with many tens of thousands of people in their broader community. The survey that you're about to hear General Michael Linnington first discuss, and then we'll see a video, and then we'll have a panel discussion and involve all of you. The survey, I think, involved 34,000 respondents, and it's a number of years now they've been doing this, trying to capture everything from the access to work, to the access to good health care within the VA system, the access to mental health care, general sense of happiness in life and of being able to get education, get jobs. All these things are addressed through the survey. So it's not just important for helping us remember our men and women who have done so much for the country, but also it should be a guide to the future policy debate as we think about areas where we still need to do better by our men and women in uniform and those who have served and their families. So again, I just want to now introduce General Michael Linnington, retired. He is the director and CEO of the Wounded Warrior Project, had a distinguished career in the U.S. Army, went to West Point, wound up commandant of the cadets at West Point, wound up also doing stints in Iraq and Afghanistan. I had the good fortune of meeting him in those places and learning from him there. He would have been very busy tomorrow as we all honor President Bush, because his last military job was, in fact, in charge of the National Capital Center for all the various activities that occur here. And after retiring from the Army, before taking the Wounded Warrior Project job, he was the first director of the POW MIA agency within the Department of Defense. And so it's an honor, General, to present you and again to work with your organization today.
What a kind introduction. I've known Michael O'Hanlon for many years, and certainly his advice and counsel back in the early days, 2003, 101st Airborne Division, and over the last many years have really been insightful, not just for me, but for those I work for. And good morning, everyone. It's great to be here. Great to be among so many friends and colleagues and talking about a topic so important to all of us. It's also great to be at Brookings, National Center of Excellence, and obviously one of the most important think tanks here in Washington, D.C. For those of you that haven't met Mike O'Hanlon, he's been providing sound and relevant advice on U.S. defense strategy and national security policy to senior U.S. government leaders for many years. And I couldn't be more happy, Mike, that you're hosting us here this morning. Our Wounded Warrior Project has been transforming the way America's injured veterans are empowered, employed, and engaged in our communities since our inception back in 2003, starting as an organization providing backpacks at evacuation sites at Landstuhl, and when our warriors come home at Walter Reed and Bethesda. Our programs and services scan the gambit of mental health, career counseling, long-term rehabilitative care, and they are indeed changing and saving lives. And the warriors and family members we serve never pay a penny for our programs, because we believe, as you do, that they've already paid their dues in service to our great nation, much of it in difficult conditions in Iraq and Afghanistan over the last 17 years. Since September 11, 2001, more than 3.3 million young men and women have served our nation in uniform. As of the end of November, 52,784 servicemen and women have been wounded in action in combat against our enemies. By DoD estimates, more than 380,000 have sustained traumatic brain injuries, and tragically, 6,978 have made the ultimate sacrifice defending the freedoms we enjoy as Americans. Important to Wounded Warrior Project and today's survey results, which we'll talk about in a little bit, by 2008 RAND estimates, 20% of those that have deployed to Iraq and Afghanistan are still suffering with the effects of post-traumatic stress disorder. More than 122,000 wounded warriors and 31,000 of their family members over the last 15 years have reached out to Wounded Warrior Project for assistance, and we count them in our ranks and we call them our alumni. The number of veterans reaching out to Wounded Warrior Project, surprisingly, but not so surprisingly if you think about it, have increased month by month. And in fact, over the last 2 months, they've been our busiest period, with more than 1,700 young men and women reaching out to us for help in October and 1,500 in November. Despite a much smaller number of troops deployed in Iraq and Afghanistan than during the surge of the past decade, which I know Michael has written about extensively. So the need is certainly great and growing, and that's why Wounded Warrior Project exists, and that's why today is so important. Each year, WWP invests nearly $200 million on programs and services for service members, veterans, and their families. And in 2019, that number will exceed $200 million, speaking to the increasing needs in more specific terms. And each year, as Michael mentioned, since 2009, Wounded Warrior Project survey has been used to determine the areas of greatest need among our alumni population. And we've used that information to quickly direct investments in areas that will most positively impact rehabilitation, recovery, and transition of our wounded veterans into communities across America. And that's really the science behind our programming. This year, for the first time, we are also highlighting 5-year trend data, which we will use to help prioritize our legislative and policy efforts led by Renee Bardorf right here in D.C. at the federal level. And as Michael mentioned, that's certainly part of what this survey will bring to the table as well. Together with our partners at DoD, VA, and in the VSO community, our survey should also inform and prepare troops and their families for future conflict, while improving the support we provide when they return home. No two people are more committed to those priorities than Dr. Keita Franklin, the National Director for Suicide Prevention from the Department of Veterans Affairs, and Mr. Tony Curta from the Department of Defense, the Office of Personnel and Readiness. Two friends of mine who I couldn't be more pleased are joining us this morning. Keita, Tony, thank you both for taking time this morning and sharing your valuable insights, along with our amazing research director, Melanie Mousseau. Dr. Mousseau, she's out back here as well. We'll now play a short video on the survey, and then I'll ask Dr. O'Hanlon to take it from there. Please roll the videotape.
Since 2003, Wounded Warrior Project has tirelessly advocated for the men and women who serve our nation, transforming the way injured veterans are empowered, employed, and engaged. For the last 9 years, we've conducted the annual Warrior Survey to gain the deepest understanding of the challenges more than 3 million post-9/11 veterans face every day. This year, 33,067 warriors participated, making it the largest, most statistically relevant survey of its kind. The responses have helped lay the foundation for modern methods of veteran care. The survey is conducted to identify warrior needs and gaps in existing resources, while tracking trends and changes in the challenges faced by our nation's bravest men and women, ultimately driving policy at the national level. Most importantly, the annual Warrior Survey provides warriors an opportunity to be heard by decision makers and advocates. This data tells thousands of individual stories, each unique with different hardships and triumphs, speaking as a unified voice of many to tell the story of one. 84% of the warriors surveyed were men, with an average age of 40. 67% were currently married. 6% were currently active duty. 45% have deployed 3 or more times. 93% of those into combat areas. 62% have a disability rating of 80% or higher. 90% of warriors surveyed have 3 or more injuries or health-related problems related to their service to our country. 51% reported their health as being fair or poor, and 52% of warriors are obese. While physical health continues to be a challenge, the number of warriors receiving the care they deserve is growing. 75% of warriors received health insurance through the VA. Warriors also cite mental health issues as a barrier to finding meaningful employment. 12% of non-active duty warriors are unemployed. Some of the most painful injuries aren't physical. This generation's signature wounds of war can't be seen. Nearly 1/3 of warriors had difficulty getting the mental health care they needed, citing scheduling conflicts, fear of painful or traumatic memories, and concerns of jeopardizing their future career plans. Awareness surrounding mental health issues is increasing, and more warriors are seeking help. 71% of warriors cite the VA as one of their top resources for addressing mental health concerns. To help combat unemployment, many warriors are equipping themselves with education, and their overall education levels are increasing. Nearly 1/3 of employed warriors have found work in the federal, state, or local government. 27% of warriors say their financial status is better now than a year ago. 60% of warriors are homeowners, compared to 48% in 2014. The numbers speak for themselves, because not every warrior can. These are the challenges our veterans face, and the need for action is still great and growing. Our warriors fought for our country. It's our time to fight for them.
Thanks for watching. Be sure to like and subscribe for more videos from Brookings.